Chapter 3, Part 3, Health, Wellness, and Health Disparities. On page 70 through page 73, at the top of 73, it talks about the various health models. So, health models of health promotion and illness prevention. They help providers understand why and how people behave to promote health and prevent illness. And it helps providers also to understand and relate these behaviors to diverse economic groups and cultural backgrounds. So, the first belief we're going to speak about is the health belief model. So, free or low cost screenings and health information are available to this population, and in most areas to help detect disease early and to educate about prevention of disease or maintaining a healthy lifestyle. So, this particular model focuses on what people perceive or believe to be true about themselves in relation to their health. So, this perception includes their susceptibility to disease, how serious they perceive a disease is, benefits to the treatment or action for the disease. Right, our next one we're going to speak about is 171, and it's talking about health promotion model. The health promotion model, it was developed to illustrate how people interact with their environment in pursuit of health. So an example of this is, according to our text, I don't know if I absolutely agree with this, but the high self-esteem person defines themselves as healthy and has adequate income, is less likely to use alcohol and tobacco, and more likely to follow a healthy diet and take part in regular exercise. So this is according to your text. However, it's also stating that a person with lowest self-esteem have some poor health habits and social economic status, poor nutrition, not exercising, have addictive behaviors, or are addicted to substance abuse. So ultimately, what it's saying is, if you have high self-esteem and in a financially secure position, you're likely to be more healthy and not have bad habits that will deteriorate your health, such as addictions. And if you are of a low income background, economic status, therefore you are likely to have bad health habits, likely to have low self-esteem, likely to have addictive behaviors. So this particular health model um, believes that behavior-specific, knowledge-based relationships are considered major motivators for health-promoting behaviors. Health illness continuum. So the health illness continuum, we have a little picture on page 71, figure 3-5. It shows the normal healthy human. And if you go towards the left, it's showing you illness, and then it's showing you death. And if you go towards the right, it's showing you good health, and then it's showing you high level wellness. So the illness continuum is one way to conceptualize a person's level of health. So this model views health as a constant changing state, with high level wellness and death at the opposite ends of the graduated scale or continuum, which is our figure 3-5 on page 71. Then we have our agent host environmental model or environment model. The agent host model, model of health and illness. It views the interactions between the external agent and a susceptible host and the environment as cause of disease in a person. So this is considered a traditional model, and it explains that certain factors um, place some people at risk for infectious disease. So the model is currently helpful for the COVID 19. So that's a good example. So the more you were exposed to COVID as a health worker, the more likely you were to actually become infected with that particular disease. The use of this model is limited, however, to infections. So it is limited when dealing with non-infectious diseases. Okay, so this model is only good for infections. Stages of change. So stages of change, we have 6 steps here, and this is all on page 72, and then we have a picture, figure 3-6. I suggest that you read this and know this. So the model is widely used today by counselors addressing a broad range of behaviors, including injury prevention, overcoming drug and alcohol addiction, and weight loss. So I will read the 6 stages to you. So we have pre-contemplation, no intention on changing the behavior. They're just thinking about it, right? Then we have contemplation, aware problem exists, but no commitment to changing or making any actions. So they may be debating on getting started, however, they just have not developed the plan or implemented the plan. Preparation, intent on taking actions to address the problem. So maybe, they're trying to plan how to get childcare so they can go to Zumba in the evening, right? So they're trying to prepare for that, make arrangements. So they're in action to be in action. So then our next one is action. So action, active modification of behavior. So now we have decided we need to go to Zumba. We have secured a child care center for our Monday, Wednesday, Friday class. And now we're actually participating. Maintenance, sustained change, new behaviors replace old behaviors. Now, this particular individual has been going to Zumba routinely for the last 6 months and is now interested in becoming a Zumba instructor and teaching classes 5 days a week, right? So now not only are we maintaining it, we are putting to action, but we are maintaining this active behavior, quite different from where we began in pre-contemplation. So then you have relapse. So fall back into the old patterns of behavior. So this individual has exercised 3 times a week, studied to become a Zumba instructor herself, has started her own classes 5 days a week. However, now this person is relapsing and falling back into old habits. So now she has taught one session 5 days a week, but now she's feeling overwhelmed. Oh, I don't have time for the Zumba classes. I have my full-time job to do. I need to take a break. And they are now relapsing back into their old habits or old behaviors. Or they have continued that, lost the weight, became healthy and now are no longer interested in continuing the maintenance, and they are relapsing. And we're back to the beginning, contemplation. So the next few slides talk about the various health models in depth. So I went in depth on, I believe, slide 2. So I will not spend a lot of time on each of these slides. However, they are on Canvas for you to access. All right, so the health belief model is what people perceive to be true about themselves in relation to their health. Okay, and their perception of how serious the disease is, how susceptible they are to the disease, and the benefit of the actions to prevent the disease or for healing and treatment. Okay. So some factors include demographics, psychosocial, and structural variables. So the health promotion model um, is developed to illustrate how people interact with their environment as they pursue health. Okay, so it could include personal, biological, psychological, social, cultural factors, which are predictive of health-related habits. So the revised health promotion model, it looks like the second paragraph on the right hand side of page 73. It talks about the revised health promotion model. So it includes additional variables, and these variables are activity related effects, commitment to a plan of action, immediate competing demands and preferences. Behaviors may induce either a positive or a negative subject response or effect. All right, so this was not mentioned on the second slide. However, this health promotion model was revised and it looks as if they added a few more variables. So the health illness continuum, it illustrates a dynamic, ever-changing state of health as a person adapts to change in internal and external environments to maintain a state of well-being or to achieve homeostasis. This picture refers to the health illness continuum. So you have the normal person, normal healthy person in the center. On one side, you have illness that progress to death. Then you have good health that progress to high level wellness. Host agent environment model. So these three factors are constantly interacting, and a combination of factors may increase the risk for illness. So the use of this model is limited when dealing with non-infectious diseases. So this is a model is more effective with infection and the potential of developing an infection from an infectious disease exposure. And your textbook used COVID-19 as a great example. So this model, the stages of change model, it's 6 stages. However, this slide is only listing 4. So we have pre-contemplation, we have contemplation, we have preparation, we have action, we have maintenance, and then we have a relapse. And I did explain all 6 of those on our second slide. Okay, so which model of health and illness views health as a consistent, changing state with high levels of wellness and death being on opposite ends of a graduate scale? A. Agent host environment model. B. Health illness continuum. C. Health promotion model. D. Health belief model. Give you a few seconds. And the answer is B, health illness continuum. If you recall, I talked about the picture on the bottom of the page. It had the arrow that went from illness to health, away from the healthy body. And then on the other side, it had the good health and then high level wellness on the other side of the body. So the health illness continuum measures a person's level of health on a graduated scale. The agent host environment model refers to the interaction of the agent, host, and environment, creating risks that must be examined. The health promotion model illustrates how people react to their environment as they pursue health. The health belief model is concerned with what people believe to be true about their health.